When it comes to healthcare for seniors, a perfect storm has been brewing for years. The number of people in the world over 60 years of age is exploding, and we're currently living through what experts have called an epidemic of loneliness, in which even the most connected people feel isolated. Research shows that when patients are socially isolated, they tend to be less healthy overall. Enter Lena, the AI chatbot fighting social isolation in seniors, founded by CEO Alex Harb.
One of the biggest themes that we saw in Medicare patients was that there was this challenge of healing alone. And with patients now living at home longer, families living out of state, there was a lot of social isolation that was happening that we saw. It was really tangible. It was prevalent everywhere.
Alex and his team built Lena as a text-based companion that uses artificial intelligence to connect with a senior while they're at home. The chatbot checks in like a friendly neighbor, but also has the capability to instantly elevate a situation to a professional care team. The system extracts important information from the patient's response, like an increase in pain or the fact that the patient is struggling to pay for their medications. The system uses these data points and trends over time to know when to alert care team members and when to send additional resources. Then, a day or two later, the system automatically checks back in to track progress and close the loop. One of the reasons StartUpHealth is proud to back Lena is because they've proven their leap of faith assumptions in the real world. Their partnership with the Greater Houston YMCA saw 60% engagement and was able to increase attendance at health and fitness classes by 30%.
And so we were only engaging seniors that were not going at all. Some had not been going to their gym between 30 days and some up to 500 days. So more than a year that they had not been going out, right? So we wanted to really see, can we drive them to go and participate and meet others?
Harb and the Lena team are tackling the access to care and longevity health moonshots by connecting with patients at scale, eliminating social isolation, improving outcomes, and lowering costs.
So we think that in the future, as we provide a centralized companionship service and system that can be fully empathetic, fully conversational, we can solve the problems each person has, but also be there for them as a support system. So that is the goal that we have, that each person can have access to their care team without this fragmented care that we see today.